right, everybody. Thanks for having me. My name is Scott Dufour. Actually, this is the one chance I get to use my title, Dr. Dufour. I am a doctor. Doctor, untraditional to you, not a MD or a DO. I am a Pharm.D, which is a PhD in pharmacology. So I'm a doctor of pharmacy medicine. And I work for Beaumont Hospitals. I'm in charge of the pharmaceutical department, which covers all the inpatient as well as the outpatient facilities, the infusion centers, and some of the offshoot locations. So today we're going to talk about some interactions regarding herbal medications. If I can get my slides up, I will do that real quick. And
It's going to take us a second.
it's going to take a second. So today, how many of you people are on more than 5 medications? Okay, so a couple of you, about half of you. Generally that's the case. What about over-the-counter medications? Does anyone take over-the-counter medications with your? Okay, all right. So that's what we're going to talk today. Yes.
Do you call a vitamin a medication?
Yes. In this sense, we're going to call it a medication. We're going to call it a supplement. There's different names for it. Nutraceuticals, you might hear that term. Supplements, maybe one of the other terms. Incidental medications, those types of things. But I would consider anything that you take into your body and has a pharmacological effect would be considered a medication. So this is going to be real casual. I'm going to have a sit-down conversation. I'm going to go over some of the stuff, some of the most common interactions, side effects of some of the stuff that you might encounter, how it works in your body, how it may interact with some of the medications you've been on, and then hopefully you guys can get a little knowledge out of that and take that back with you in case you're thinking about being on medications or supplements. And I would always encourage discussing with your physician first, because there's a lot of things out there that could be marketed for multi-purposes, and sometimes it's not always known what those effects will be or how they'll interact with your medication. See how we're doing here. Okay, we're good. I think we're up and running. So like I said, my name is Scott. Feel free to raise your hands and stop me anytime at any point. We're going to talk about dietary supplements, interactions with prescription medications as we. So for all of you, this is kind of a general run through of what happens to your body when you take a medication. There's different ways to absorb medications. And we're going to talk mostly about the oral form today, which is your tablets, your capsules, any type of sublingual, those kinds of things. So when you take a medication, it stays in your body for a certain amount of time. Generally, depending on the drug, it will be absorbed in your upper GI system. So your upper colon, so your larger intestine, and then it will move into your smaller intestine. So that takes about 45-minute transit time for it to get from your stomach, for it to be pushed out into your intestines, and that's where most of the absorption happens. Not that much happens in your stomach. Everyone thinks there's stuff that happens in your stomach, but most of the things that happen in your stomach would be degrading some of those medications. It could be because of the acid in your stomach or some of the other medications that are sitting in your stomach. So, okay, what happens when a medication interacts with another substance that's in your body? And that substance could be a dietary supplement, it could be another medication, it could be something you ate or drank, it could be alcohol, those types of things. So there's different things that happen. Medication, foods, and dietary supplements are the largest ones, and we're going to talk about those today. So some of the interactions that can happen in your body is it can increase the actual time of the drug in your system. So what it would do is it would prolong the effects of the medication you're on. Okay, it could work reversely also, so it could speed up the effects of the medication you're on. So think about that in 2 ways. So if you've got a medication that's supposed to be a shorter acting and now you've made it longer acting, it's going to be with you, giving you those effects maybe longer than you need or wish, and that could lead to side effects. The same with if you need a longer acting medication, let's say a blood pressure medication that's designed to be once a day, you take a drug that's interacting it and speeding up its metabolism, and I'll use that word, metabolism or excretion, then it's not going to be with you as long. You're not going to have that full effect, and you're going to have breakthrough. So let's say your blood pressure medication is supposed to go 24 hours. You take something interacts, and now it burns up in 18 hours. For the next 6 hours, you're going to have high blood pressure. So that's a simple example. So we'll get into some of those. Okay, what can happen is kind of what I alluded to. Making the drug stay in longer doesn't always mean it works better. A lot of people think, well, that's great. Wow, why can't I just take a once a day and take this drug and interact, and I'll get it twice a day, and I can cut down on my medications. I hear that a lot. So I can save my medications for 60 days and 30 days. Well, no, that medication is designed to work in a specific amount of time, and releasing it in a different way than it's intended could have ill effects. So you could get a spike in your blood pressure, you could get a spike in your sugar, depending on what you're on. So that's not always a good thing. Combinations that increase the amount of drugs to stay in your body can result in increased side effects. As I said, so if there's a drug that's interacting with another medication and it will cause it to linger along further, you can get extra side effects because some of those drugs, when they build up, that's when you get the side effects. You might not initially see them as anything that you would feel, but as they build up in your system and you can't release them because you're interacting, then you see a lot of side effects. For example, if some of you have ever been on a steroid medication called prednisone or anything like that, those medications generally pretty safe and effective for what they're for. They're for inflammation. A lot of people take it for lungs if they have COPD to clear up your lungs and help your breathing. But when they're prolonged and they sustain levels in your body and it builds up, it can actually cause sleep disturbances, it can cause confusion, those kinds of things that you wouldn't expect from just something that's supposed to open up your lungs. So that's kind of one of the things. Decreasing the time and drug in your body can increase how long you have to take your medication and okay, so what we're talking about there is decreasing the time. So the opposite of what we talked about. So now it's burning up faster. So it is being inhibited, the effects are being inhibited by something else. So it's not going to last in your body as long. So your condition can get worse, and you may go to the doctor complaining of X, Y, and Z. So he or she sees it as the condition getting worse, prescribes something on top, which we see all the time, when really it was being managed properly, but the interaction was causing the problem for the breakthrough. And then also, it'll delay how long you feel better. For example, antibiotics. If you bind up certain antibiotics in your GI with milk or calcium products, sometimes you'll see that. You're binding up that antibiotic that's in your stomach. It's not going to go through and be absorbed the way it's supposed to, so you're going to get less of an antibiotic effect. Your pneumonia or your infection is going to stay with you longer. So that's why interactions are pretty important, and people don't quite understand how they all work, and I'm trying to give you kind of a basic overview here. And so what the discussion today was going to be about was dietary supplements. How do we manage those? What are they? What would the possible problems be? So as you see, we got vitamins. You asked about vitamins, vitamin C, D, E. There's all kinds of vitamins out there. There's vitamins, there's minerals, calcium, iron are considered the top ones. And then you get into herbs, which are more the nutraceuticals that have come out recently, and a lot of press about those in the past maybe 10, 15 years, people using those. So you've got echinacea, ginkgo, garlic. Enzymes are generally for your immune system and your GI, so you've got a lot of those. And then amino acids, which are a little more rare, but some people do take those. Any questions so far? So what's important to know about the supplements is they are not marketed and are not approved through the FDA. When everyone thinks of medications, they think of the FDA and the scrutiny that goes through the process with those. Those do not go the same process. So the reason the FDA is set up is to make sure that everything is safe and effective. I'm not saying they're not safe and effective, but they just don't go through the scrutiny. So there's not a lot of animal testing, human testing before they hit the market. So therefore, they can't make some of the claims that they would, and there is no interaction testing on those. So that's why everything that we are going to talk about and that we know about is through reports of historical happenings that people have taken this and that together. The FDA cannot take action unless a product is deemed safe after it's already on the shelf. So basically, the FDA will not get involved in these unless there's a purity issue. some type of recall. Sometimes they will issue alerts regarding medications and interactions for these things. But just so you know, those supplements are not regulated, and they're not all the same. So you have to really read the ingredients. One manufacturer might have different process for making them. There might be more or less fillers, so they're not all equally the same. So just so you know. Okay, the USP is the United States Pharmacopoeia. It's a nonprofit organization, and the standards are set. Are used in over 140 countries. This is kind of like the global industry standard. The USP has standards for what the quality and safety and effectiveness of the pharmaceuticals have. And that's what USP verified products are, the highest quality products. So those are the ones that you want to look for. Products with the USP label have been tested to ensure, and here's like I talked about, the ingredients listed on the label in the declared amount. So they will say that they're 40% echinacea and 50 or 32% something else and a filler. So they have to comply by the stringent requirements of the USP. So if you look and on the label, you will see which ones are USP identified as meeting the requirements. And if USP verified, it also doesn't contain harmful levels of contaminated mercury, pesticides. Some of these other ones, especially ones coming out of other countries, they have minimum amounts that they can allow for different contaminants in there. So if you stick with the USP quality product, you're much better. And the pharmacist at the store can help you, and it should be pretty well labeled. If not, the first couple times you ask the pharmacist, and he or she will point out what to look for there. It will break down and release in a specified amount of time. They also have gone through different types of analysis. So it says it's going to break down and act within an hour. It will act within an hour. Some of these other ones that are not in the USP, they could be from 15 minutes to 7 hours. So you're waiting for effect, and now you're not getting that effect. You think, well, it's not working, take another one. Now there's a problem, because when those two do hit, that's a problem. And then it has been made according to FDA good manufacturing practices. So this is a high quality standard that all pharmaceutical companies must comply by. So that's the highest level. So getting into garlic, and if anybody has any of these I go over, raise your hands and tell me your experiences with them. But so garlic is one of I picked probably the top 7 of them, and it comes out of the article that's available here. So garlic, a lot of people use it for high cholesterol, high blood pressure, diabetes. Probably the biggest thing would probably be for the top 2, the cholesterol and the blood pressure. Possible interactions is very common in your group. I know that some of you must be, or maybe not, would be on a blood thinner called warfarin or Coumadin. Sometimes that's very common, okay? So for atrial fibrillation or for clotting, to prevent clotting, you're on a blood thinner. Well, the problem here is there's a possible drug interaction with the garlic that's not well known, and it decreases the effectiveness of the drug. So, increases the effectiveness of the warfarin. So now let's say your doctor has you on 5 milligrams of warfarin, and he's testing you based upon that, and he says, okay, everything's good, and you go and you start adding garlic to it. Now it's more like you're on a 7.5 milligrams. He or she doesn't know, and all of a sudden your INR, which is a test that they test your blood level, your clotting, it goes through the roof, and you can have a risk of bleeding. So that's a big one. So anything that we consider a bleeding risk is a big one. Decreased effectiveness, see, it can actually go the other way, like I said. It can go to actually inhibit the effectiveness of the other drugs that you're on. These are more in the antiviral areas, and they're kind of rare, so I don't think you probably would be on those. Echinacea, anyone use these? Echinacea are for coughs and cold type preparations. They're in there touted as decreasing the viral load and decreasing the length of your cough or your cold, the common virus. Respiratory infections, yeast infections, urinary tract infections. Probably the most prevalent would be the cough and cold products. It increases blood level of caffeine. So if you're coffee drinkers, Now, see, because of the way that this works and the interaction in there, you might feel like you're drinking 5 cups of coffee when you only drank 2. So you're going to be jittery, you might have insomnia, those kind of things. And that's a common one we get. And people say, I don't understand, and why am I jittery or nervous or agitated all of a sudden, and anxiety and can't sleep? And that's a common one. It does do the opposite effect on some other drugs here. These are all more immunosuppressant drugs that are used for, including deltasone, which is a prednisone. In transplants, I don't know if there's a transplant patient here, but those are kind of rare, but it would decrease the effectiveness in those transplant patients, which they need those to sustain life. So now if you're adding something as simple as this, that's going to be a problem. So see how serious these could be. If you just had a liver transplant, kidney transplant, you need this to fight your autoimmune system for rejecting it, and now you add something as simple because you think you've got a common cold, and then that's a problem. St. Johns Wort is one that's been used for anxiety. This one is big back in probably the early to mid-90s, touted as a replacement for some of the Zoloft, Paxil, Prozacs, and all that as a natural remedy for anxiety, depression. I even used it in smoking cessation, trying to get people to stop smoking. It does have a lot of interactions. There's probably more than this one, but for this group, I listed the ones that are kind of common. It decreases the effect of Xanax. Xanax is an anti-anxiety drug. A lot of people take it to take the edge off nerves, kind of like a Valium, the old school Valium. Well, it will decrease it, actually inhibit the effects of that one, so you would have a lot more agitation. You wouldn't see as good of results. So you might end up taking more Xanax again, and now you're getting in a problem where you're taking something that can make you sleepy or a depressant in a sense. Decreases the effect of or birth control, and also reduces the levels of digoxin, digoxins are very common. They're getting away from it now, but a lot of people have been on it for many years. Digoxin for heart, to help your heart muscle beat stronger, better, faster. So digoxin is a heart medication, and obviously the pump needs to work off that digoxin for a reason. That's why you were prescribed. And if you add something like St. Johns Wort, it decreases that. Now all of a sudden you go into what they call congestive heart failure because your pump isn't working so good. And the doctors are kind of puzzled because patients come in and they kind of forget because they ask you taking anything new and they're thinking of medication-wise, prescribed. They add this stuff from their local CVS, they don't think, and so the doctor is puzzled why is all of a sudden my regimen that I prescribed is not working.
I found out in my pharmacist too that the St. John's Wort was counterindicated to my cholesterol medication, Simvastatin.
Oh, yes.
Which I was eternally grateful that I found that out, but I had no idea.
Yes, and I think I might have even had some cholesterol stuff in here, and I'm sure he or she told you about the interaction with the grapefruit juice.
Yeah, that I knew.
And,
that I knew.
And that one, when that first kind of came out, that kind of took people back. They said, how can grapefruit juice, how could that? Well, it inhibits the enzyme in there that's going to metabolize it so your level can go up, you can get more of the rhabdomyolysis, those types of things. So yeah, there's a lot of strange things out there.
So I was, like I say, I could have really been doing myself some harm here with the malabsorption problem I would have created myself.
Absolutely.
Who knew?
Right, no, that's great. That's where, it pays to ask your pharmacist. He or she is behind that counter for a reason. If you're picking up one of those bottles and you're thinking about it, ask them. Say, hey.
Well, actually, I was talking to her about something else, and she just happened to mention.
Oh.
That's how it was so inadvertent that it was like a true blessing for me.
Yep, that's great. It's great. Ginseng. A lot of people take ginseng. Sometimes they put it in they have a ginseng tea, or they take capsules, those types of things. It's been touted to be boost your immune system, so to fight off common colds and that kind of thing. Decrease your blood sugar, diuretic, and digestive aid. So it's kind of been used in a couple different things. I see it mostly as an immune system booster, but it does have interactions with the warfarin I mentioned, which is the blood thinner that people need to be on for atrial fib, clots in their leg, DVT. So let's say you had a hip or knee surgery, you're going to be on those blood thinners. So it'll reduce the effect of the warfarin. So now instead of the other situation where you might have bleeding, your more apt to have a clot, and that's what you wanted to prevent, because the clot can actually travel to your lung, which would be a PE, which would be very fatal if not treated, or it could be a heart attack. It also may decrease the blood sugar, so they use it in caution when you're taking some of these. These are diabetic, glycinase, micronase, actose, avandia, insulin. All of those hyperglycemics, so anybody that's a diabetic, whether type 1 or type 2. Type 2 is when you take the oral medications. Type 1 is when you take insulin, so you're insulin dependent. The problem there is it affects the blood sugars either way. So if you take it when you take your insulin, you may have a crash in a blood sugar. And nothing is worse than a crash in a blood sugar below, let's say, 60, 50, in the 40s. So the hypoglycemia is more acutely detrimental than having high blood pressure. So this could cause a major decrease in your blood sugar. Palmetto, they use it for what we call BPH, is benign prostatic hypertrophy. It's a male thing where the prostate's enlarged. They also use it for a sedative and a mild diuretic. I see it mostly as a diuretic, so people that might feel a little water retention, those kind of things. Females take it when they feel bloated. Sometimes there's some of those over-the-counter medications for that. Sedative, also marketed for that. The interactions, these ones would be pretty rare unless you're being treated for some type of prostate. The Proscar, the interaction with the Proscar and Ulexin are actually for prostate indications for prostate cancer. So that's probably, I'm sure the doctor would go with that. But it does interfere with estrogen therapy and oral birth control just by the nature of the way it works. And birth control is the way the mechanism works is through an estrogen progesterone mechanism, so that's why they're kind of. Let's see here. Valerian. I actually just recommended this to my 92-year-old grandfather who has trouble sleeping because he can't take a lot of the over-the-counter Benadryl, just knocks him out for 2 days. Makes him confused. Xanax just makes him loopy. So Valerian is just a natural root for anxiety, depression, insomnia. It's very good for insomnia. It just kind of more mild sedative effect just to get you to sleep, doesn't linger very long, as long as not combined with some of the other sleeping agents that are out there or antihistamines. It's a pretty good choice, especially for a person who wants to go all natural or can't handle some of those other ones. And obviously, anything that's going to cause sedation like that, CNS suppression, you have to be careful with alcohol. So even 1 glass of wine, 2 glasses of wine are going to make the sedative effects. So make you sleepy, drowsy, could even cause a loss of balanceness if you got dizzy and fell, that kind of thing. And then there's the, excuse me, for the same reason, the Xanax, Klonopin, Valium, those are all kind of in the same anti-anxiety bucket. So just be careful because this one is used for anxiety and insomnia. So it's kind of a down, a mellower pill. So it would mellow you out, for lack of better terms. And you combine it with some of those other ones, you might end up passing out, falling asleep, having a fall, that kind of thing.
So if it mellows you out, what in the world does it do with depression?
Well, exactly. That's why I probably wouldn't ask anybody to take it for depression. They do market it. See, there's different types of depression. I think it's more for the people that would have swings. So bipolar now we call. So there's mania. Some people get ups and downs, and I think it would probably help level the mania, the more excitatory.
Oh, okay. Great, but more of
A balance.
balance. Yeah.
And that's kind of what they're doing now.
Oh, okay.
Ginger, and everyone knows ginger because ginger is great for your GI. I mean, I've been on boats when I've got seasick and somebody gave me ginger root. Works great. Ginger ale. Ginger ale, probably not a lot of ginger in ginger ale, but there is a little bit, but you notice it does settle your stomach. So a lot of people have these homeopathic old-time remedies for ginger, and I believe it. They are good for settling your stomach. Not the best nausea and vomiting, but more like an indigestion, upset, queasy stomach. Obviously, you wouldn't want to put anything down your GI tract if you're already vomiting, because that's just going to probably make it worse, unless it was specifically designed for that. But the possible interactions here, and these are with some of the newer drugs. Coumadin I mentioned, which is a bleeding, blood clotting drug. Lovenox is more of an injectable to prevent clots, and heparin is an injectable one too. They could increase the risk of bleeding also. So that's another one. So these are the most common ones that you can see with ginger, but other than that, ginger is pretty good for your stomach if you want to, something that's mild and over the counter. Kava, here's another one that's, kava comes from, I believe it comes from a berry, and it's orally taken. It's for insomnia, anxiety, but topically also you can put it on topical on your skin and it will be absorbed. Wound healing in leprosy. Not that we have a problem with leprosy these days, because that's kind of gone by the wayside, but that was a claim to fame. So then they tried to look at it, would it promote some other wound healing, and it does have some claims to promote wound healing. Also, they make a mouthwash. You can make a mouthwash, and I think they commercially make one, which for canker sores, and I know as a young child I used to have a lot of canker sores, and there was a lot of different remedies, salt and all these, baking soda and all this stuff. This one is probably the less painful one and actually promotes some type of healing. Alcohol and any antidepressants, so, and I mentioned antidepressants, so Paxil, Prozac, Celexa, Trazodone. I'm trying to think of the more common ones that would be used these days. And they would also cause you drowsiness and actually some type of motor function. When I say that, just basically confusion, and you might end up stumbling and falling, or coordination kind of a thing going on there. Let's see, and then cranberry. Everyone loves cranberry, right? Cranberry, drink a lot of cranberry. Why do we drink cranberry? Because we prevent UTIs. That's kind of, and it does, and that is because it creates an environment that the bacteria can't thrive in the UTI, and that's why that does work. So that isn't just a wives' tale. Scurvy, it does have vitamin C deficiency. I probably wouldn't use it for scurvy, not that we see that much scurvy these days, but if you have scurvy, you're probably just going to take some vitamin C. And as a diuretic, since the way it works, it will promote decreased urinary retention, possible bleeding risk with Coumadin. So this one interacts also with the bleeding, or the bleeding drugs, the anti-bleeding drugs. So, or anti-clotting drugs, excuse me. So as you see, a lot of these interact with mostly, the most serious ones are the bleeding drugs. Is anyone on those anti-bleeding drugs, if you feel like talking about it? Okay, great, that's good. No Lovenox, no warfarin, or there's some new ones out there, Pradaxa, Eliquis, those are new ones, and you see the ads on TV. So those are probably the most common ones to see serious interactions. And there's interactions that are smaller, and you have to really look at them and say, okay, is this a serious interaction? Is it worth even creating the hype or the hysteria about? And most of them are probably low level. So that's why we try to bring the bigger ones to you. So now I didn't cover, this was taken from the article they asked me to cover, which somebody gave to me. And I was actually the stand-in presenter today, so I didn't add anything other than that. So I was going to leave the last couple minutes just open up for discussion regarding interactions and anything that you guys have been on. Yes?
What happens when you take calcium with prescribed medication?
Well, it depends on what a most common interaction would be that would bind up the other drug. Okay, in the gut, some things need to be absorbed in an acidic environment. So an acid, so you have acid in your stomach. Calcium tends to reduce it because it's alkaline. Okay, so that's why it calms your stomach. If you drink milk when you have an upset stomach and you have an acid stomach, that kind of thing. So some of those drugs need to be in an acidic environment. So if those drugs can't be absorbed, you're not going to get the effect. You're most likely just going to pass them with probably half of the effect. So calcium is one of those things that I tell people to, when in doubt, ask your doctor or your pharmacist about the interaction, if you have a specific list. But what you can do to be safe is you can just spread those out. And when I say spread them out, I would put the drug first, your medication, your prescribed medication first, at least 45 minutes to an hour before the calcium. Because if you did it the other way around, think about that. You got the calcium still sitting in there for an hour, and then you put the pill on there that's going to be binded up. So if you did the 45 minutes to an hour from your regular regimen, you let those get absorbed, throw the calcium on top. And the biggest thing that people have to remember is Malox, or those aluminum hydroxide. They have aluminum, magnesium in them. They drink them. If you put your pills in your stomach same time as those, most of those are just going to sit there and pass right out of you. So I would recommend taking your regular medications and then your calcium. Anything else? Anybody else got any other interesting combinations that you guys take?
Did I understand you to say that you should avoid milk when you take antibiotics?
Some antibiotics.
Some. Okay.
Some are actually, I guess, yeah, I should clarify that. So I was thinking of there's a tetracycline interaction. There's some tetracyclines that are, there's a vibramycin and a tetracycline, not that commonly used anymore. And generally, when you get the prescription bottle, it'll say on there, avoid calcium products. That's for that absorption reason. The other ones are hard on your gut, so they recommend milk or food. So I think some of the more common ones, azithromycin, a Z-Pak, I don't know if anyone's heard of that one. Biaxin used to be a big one. The penicillins, anything that can upset your stomach, take with food or milk. And that is no interaction. It just kind of lines the stomach and prevents any irritation. Because when those drugs dissolve from the tablet or the capsule, they're kind of irritating on the lining. So what that does is kind of coats it in the same way that, what's the, Pepto-Bismol, kind of coats it. Everyone knows that. Not that I would recommend Pepto-Bismol with your medications, because now your absorptive lining in your GI is being coated too much. But milk, on a smaller level, just kind of settles the stomach. So yeah, so I wouldn't want to confuse you with that. Yeah, definitely, antibiotics only some, and they're pretty good about, most pharmacies are pretty good about that, because it's a common interaction in our world, pretty good about labeling those on the bottle. That is a manual process that has to get on the bottle. So most likely, if they didn't miss sticking the sticker on there, you'll see which one it is. But it's not on the more common, the newer antibiotics.
Yeah, I just never heard that. So.
Yeah, that was a big one. And then there's some that actually, and I didn't want to get too much into it, but for example, anyone take iron? Iron, there is a good interaction, and it works this way too, that you can take ascorbic acid, which is vitamin C, with it, because that one needs to be absorbed in an acidic environment. So going the other direction, see some of them, you don't want the acidic environment, or you do want it. This one, it promotes the absorption. So that's why they actually encourage you, and it might say that on your bottle. So interactions are a funny thing, and they can go either way, and it depends. And it's basically either you're getting the effect too much with an interaction, or you're not getting the effect you desire, and that runs into problems both ways. So if you think about it that way, when in doubt, if there's two things, ask, like I said, or spread them out, because then you know that in that time frame, it's going to be absorbed, and you can feel free to take the next one. Although that's not that convenient, because then you're pacing your whole morning every hour. But if you know for sure there's these 5 that are fine, and there's this one, just spread it out.
What about fish oil?
Fish oil, pretty benign. Not really any absorptive issues. Sometimes GI issues with fish oil. If you're taking, it's kind of counteractive to if you're taking some anti-constipation medications, because the way that it's oily, that kind of thing. So not really any interactions, because it's essentially just an omega-3 fatty acid oil. So no real interactions. I just know that there's some side effects with different brands and whatnot. The ones that are absorbed further down and don't break apart a little better, because then you don't get that bad aftertaste or the belching, that kind of thing. That's kind of the most common thing with fish oil.
What about garlic? Is there any
smell it on other people, is there any kinds that you know that don't come through your breath or your skin?
You know, I'm not that familiar with all the brands of garlic, but if you take enough of it, you're gonna get that. You know, the breath thing for sure. I would go for the longer acting ones. There's some smaller tablet ones that are more frequently taken. The longer acting capsules, because they're designed to kind of go almost through you and then be absorbed in your colon as opposed to your upper GI where you could, you know, smell it or belch it up, that kind of thing. As far as the skin absorption or skin displacement, as long as you don't take, I think, the higher doses, you know, real high doses, you're probably gonna, but I mean, it's like anything else. You eat enough of something, you know, some types of foods, you can sweat it out. So I would just go with the longer acting ones, like the once a day, because they have some smaller ones that you take more frequently. I would go with the longer acting.
That's a blood thinner too, isn't it, garlic?
Yeah.
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 When I had to go in for some oral surgery,
They say get off of all those.
yeah, and I was surprised. I said, what does garlic do? And they said, it is a blood thinner.
Mhm.
Do you know that? Yeah. So, because you know, I just wouldn't,
You wouldn't think about that.
I wouldn't stop bleeding.
No, you wouldn't, right. So they're,
Yeah.
right, in surgery, and that's the last thing they want you to do is
Exactly.
continue
So I
bleeding.
wanna tell you that too. And I found that out inadvertently too one day.
Yeah, it doesn't say nothing about
No.
that.
Yeah, but that's true. And another one, I don't know, this is this interesting one. I learned this through my mother, who has some heart conditions, and garlic, not garlic, licorice. Licorice has
Yes.
anise in it, which is, you know, gives it that flavor, that, you know, black licorice we're talking. And that can actually cause dysrhythmias and heart issues, palpitations and whatnot. And she was eating a bag or two a day. She loved black licorice, and she already had a heart condition, and she was telling me her complaints, and I said, are you eating a lot of that licorice? I seen the bag there, and sure enough, I'm like, I remember something from my training, and I went and looked it up. Yeah, sure. So there's these weird things that can happen. Yeah,
Yeah.
that was an anecdotal one, but I mean that's real life. Interesting though.
You can get a lot of these products in liquid form, right?
Yes.
So is there any different absorption rates between, you're mostly talking about the pills?
Yeah. Generally, I mean, and this is generally speaking, absorption is dependent on the breakdown. So if it's already broken down, it's available in its rawest form. So yeah, you probably cut off 15, 20 minutes from that average of 45 to 30 minutes. So you get faster absorption with liquids. Just so it kind of goes this direction. The fastest would be direct IV, well, inhalation and IV push. Then any type you can time you can get it into your system faster, maybe under the tongue. Then orally, which then you capsule, tablet, liquid being the fastest. So going that kind of thing. And then rectally is slow and erratic. They use it for a lot of things for kids or people that can't take orally. Not the best route, but when you have no other choices, it will be absorbed. A lot of things go through the liver. So anytime you take a pill orally, it will go what they call first pass metabolism. Has to go through the gut, absorb through the liver, and then back into the system. So you lose some of it. So if it's a drug that's broken down by the liver, most of them are. Some are just excreted. So you will lose the drug. So let's say you're taking 100 milligrams of drug XYZ, and it's absorbed through the liver, first pass metabolism. You might actually get 60% of that, so you get 60 milligrams. So that's a problem when people have issues with liver, because now if normal dose is based upon the average person getting the 60 milligram, your liver doesn't function that well. You're getting the full 100, so that's an issue. But for the normal person and without liver issues, that has been considered when they made the dose. So just throwing that in there, it's interesting how it has to go through there. Some drugs don't. Some drugs are.
It still has to go through the liver, then too, the liquid version of the pill?
Yeah, yes, it does.
The only one that wouldn't be the IV?
Right, IV will not go. Inhalation wouldn't go, that kind of thing. I lost my train, but I was going to say something about the liver, the fast pass. Oh, some will go, most drugs go through the liver. Most of them do. Some are excreted, so there's metabolism and there's excretion. And the way they sound the same, but metabolism is the breakdown of the drug, and that's generally through the liver. Excretion is it's absorbed and goes to the kidney, and the kidney processes it, takes what it needs, and gets rid of the rest. So that's the difference. So if you have kidney issues, a lot of diabetics will lead to having kidney issues, or if you just have different types of kidney disease, then they have to worry about the ones that go through the kidney. That's probably a lot less. It's probably 20% of the drugs. Most of them go through the liver. So, and they try to work hand in hand. So your kidney will pick up if the liver wasn't, try to push out the extra. So it's just interesting that drugs will actually be metabolized or just pushed out. Some are actually metabolized to what we call it's a prodrug. So it's a drug. They know the liver is going to work on it, and it's going to give another drug, and that's the one that's going to be the effect. So the first one really wasn't the one you needed. It was the second one. So science has come a long way. They've figured it out pretty good. It's a lot to take in, but I guess the whole point is, just be aware that there's a lot of these interactions out there, and a lot of things can affect the way the drug works, from the absorption, from the form, the time you take it with other meds, sometimes the time of day, your cholesterol medication, some of those, recommend taking at night. That's because your cycle, you're making your cholesterol during the evening, so you want your peak effect while you're making the cholesterol to prevent, your HDL or your LDLs and triglycerides growing higher. So the timing, the route, binding it up with foods, liquids, other drugs, and nutraceuticals such as vitamins and minerals. So that's
Glucosamine for the joints, that comes in a pill form as well as a liquid, right?
it does,
Negatives in that, or interactions?
Well, no, not that I can recall off the top of my head. I would just say that the oral is absorbed much better and gets to the area of interaction or action that it needs to. They've done studies on whether it's absorbed, and you can make paste and people make creams. The same with ketorolac and some of the non-steroidals and that. But this is more for cartilage to build it back and stuff. And there is some absorption there. I would say probably not necessary to do both, one or the other. But I would say the oral. I remember Cosamine DS being the best tolerated and the most potent out of the ones, and that was one of the brand names I remember.
Because he takes some, but they're so darn big pills.
Those are big. Those are probably the pills.
He chokes on them, so he's found one that's smaller, still has a gel cap on, but he pulls it apart from the powder, and so he sprinkles it on his food. Because I can't have him choking on it, because we've already made a couple trips.
Well, no, and that brings you to another point. Most of the time, 99% of the time, 98% of the time, you could take that capsule, because the capsule is just how the pharmacist, and we don't do it personally, but back in the day, the pharmacist used to pack the capsule. Yeah. Now the manufacturer does that, but you can take that, sprinkle it on apple juice, apple sauce, or whatever to make it more palatable, and it will actually be absorbed. So the gelatin capsule was just designed as a mechanism to deliver it to where it needs to go, and then it be absorbed. Yeah, those are big. You can crush them. You can make a slurry. You can ask your pharmacist. Because some things are more dissolvable in certain things. Some are dissolvable in water, in alcohol. So you'd have to dissolve. You have to know what to make a slurry out of. So I wouldn't really recommend that. But just to sprinkle it on there, I think you're fine instead of having to take the big horse pill. Yeah, they're pretty big. I remember. You can just squeeze it, squirt it. It's terrible, then it's like a dead fish.
If you want the easier method, it's going to taste terrible.
Yeah, I know. it's not a perfect science. And a lot of those, because they don't have an IV formulation, it breaks down or it's not stable, that's why they have to put it in oral. So it's better that there is an option in those than putting it there. So yeah, there's a lot of different reasons they come to what they've got, and sometimes it seems like, well, couldn't they have a better idea? Well, they've tried. Believe me, they've tried. They think.
The oral, not the oral, but the liquid forms of whatever, all these, if there are liquid forms of what you've talked about, and some of these are, some are they all regulated still by the USP? The liquid versions of them?
Yes, depends on where they're compounded. And most of the wholesalers, distributors, they will hold high standards to those manufacturers. So they don't like to get things out of country. I know India produces a lot of stuff. And then there's been some question about that. There's black market drugs, and there's actually a brown market drug, which is considered, the black market is not a legal drug. There's brown market that just hasn't, it's been legal, but it came through the wrong channels and stuff. So most reputable places that you would acquire medication, CVS, Rite Aid, those kind of things, or the hospital, we will not take any drugs that come from questionable manufacturers or are not up to par. So as long as you're not going to the roadside pharmacist standing on the street corner, I think it should be good.
But some of these products you can get at health food stores too, right? So those are not really regulated too well, so it's buyer beware.
Yeah, it's kind of caveat emptor, buyer beware kind of a thing. And the smaller ones, maybe GNC is large enough now and reputable, but yeah, if you went to, I could set up as a pharmacist, and I know pharmacists that have done that because that's their thing. They set up a pharmacy with the, GNC kind of a thing, and it's probably more the mom and pop throw up this herbal medicine, holistic medicine type of thing. Those are the ones you probably want to stay away from. Anything else? Was this helpful at all? Is it good? Interesting?
Yes, sir, it was.
I was happy to do it. I just wasn't sure what to put in the slides. I didn't know. Yeah, I would have liked to have a list of people's meds, and I could have addressed them directly. But hopefully this gives you a well-rounded idea about interactions and that kind of thing. All right. Well, thank you guys for coming.